The patient is currently on Lexapro 10 milligrams, 1 tablet by mouth once a day, and she takes the Lexapro for her anxiety and depression. And she's also on vitamin D2, 50,000 IUs by mouth once a day, as she was showing to have some vitamin D deficiency on previous labs. Now, for differential diagnoses, we're looking at a brain neoplasm, as it could be putting pressure on some of the nerves in her cervical spine, and in turn be causing a lot of the symptoms that she's experiencing. Lumbar and cervical radiculopathy is also another differential diagnosis. Here we're looking at the numbness and tingling, which is also a telltale sign of lumbar cervical radiculopathy. Multiple sclerosis also has these symptoms, so we're looking at all of these diagnoses to see which one would best fit the picture. Our plan is to order the MRI of the brain and lumbar with contrast. Dependent on the MRI brain and lumbar results, we will order a lumbar puncture. We definitely will order labs, a CBC, a vitamin D level, along with calcium. Our results came back, and the MRI of the brain and lumbar was positive for lesions. They did find that there were lesions in her brain and some lesions in her lumbar area. So we went ahead and performed the lumbar puncture, which came back positive for antibodies, which is indicative of multiple sclerosis. Her labs did show that she continues to have vitamin D deficiency. Our treatment plan here would be definitely very important to refer her to neurology for further treatment and management. Now, once the patient sees the neurologist, they will determine which medication would be best to help stop her MS progression. We will continue her on the current medications, including her vitamin D2, due to her continued vitamin D deficiency. We will refer her to physical therapy to help reestablish some of her strength in her legs and help with some of the gait imbalance. We will also order for a walker so she can use whenever she's having a relapse, of the days when she's not feeling well or her strength is low, as she does demonstrate to be a big fall risk.